Yet the Commission emergency rules and program design sharply curtails access, limiting forms to a short list found nowhere in statute, imposing a 5 gram per 90-day limit that functionally nullifies the 5-ounce allowance, and restricting practitioner participation contrary to the Act's text, allowing recommendations from any state when practicing in compliance with the Uniform Credentialing Act. These concerns are set out clearly in Senator Kavanaugh's complaint analysis. The Act defines cannabis inclusively and does not authorize the Commission to rewrite those definitions by regulation, particularly through an emergency process that bypassed public hearing and missed statutory timelines. Now, for our part, the tribe is stepping up to do what the voters asked the state to do: enable access with safeguards. We are also navigating an unrelated challenge. After we submitted a tobacco tax compact this summer and began negotiations under Nebraska law, the governor, who is expressly authorized to negotiate these compacts, we were told an hour before our first Omaha Cannabis Commission hearing that the state would not move forward because we were launching a lawful medical program on tribal land. That position was later walked back pending the governor, but the signal is unmistakable. Using a tobacco compact to pressure tribal cannabis policy is retaliatory and counterproductive. This compact should have been a tax administration parody, not cannabis. It should not be conditioned on an unrelated policy area. So today, my asks are simple and constructive. Clarify that the Commission may not narrow voter-approved definitions or erase the 5-ounce alliance through ultra-low THC caps. Restore practitioner access consistent with the acts, including out-of-state practitioners meeting UCA requirements, and encourage the state to resolve the tobacco compact on its tobacco merits without retaliation for the tribe's lawful exercise of self-governance. In closing, we are prepared to work with this committee, the governor's office, and the Nebraska Attorney General's office. Patients should not have to wait, and sovereign governments should not be punished for responsible regulation. The Omaha Nation carries a heritage of peace. The Omaha people have never raised arms against the United States, and for generations they have done what was asked of them. But too often they were repaid with federal boarding schools that took their children, with the loss of homelands through river works and land takings.
Senator Roundtree, thanks so much, Mr. Chair. I'll put you back and finish.
Yes, sir. Thank you, Senator. And with policies that ignored their voice. But despite that history, our government comes in a spirit of collaboration and good faith. But let there be no misunderstanding. We are fully prepared to defend the tribe's laws and the Omaha people in the courts, in the legislature, and in the public square. If modern-day prohibitionists continue to frustrate the will of the voters and the rights of a sovereign nation. Thank you. Happy to answer questions.
Any questions? Senator Claus? Yes, thanks, Senator. Thank you for being here. And I'm not familiar with the tribe. My area of the state, we're not really work with the tribes that much, but as a sovereign entity, and just what I read in the news, you proceeded with the ground rules, and so on tribal lands, you can sell marijuana, you can, well, that you feel your regulations are within what the voters approved. So you're already doing it? Yes. My question.
Yes, sir. That's what we're doing, and we're not the only tribe in the United States that has done this. So Nebraska, let's be clear, we have a medical program that was approved by the voters. It's in statute now. The tribe is fully capable, and it's legal for us to create our own regulatory structure to regulate this substance and the will of the people to be respected through that way.
So is it to the extent that we've seen in our statutes, or is it a lot simpler, or how do you conceive of that?
So comparing, I think, the two systems right now, what we're working on, in our draft rules and regulations, we're still working out a couple of kinks, but the current draft, I think, models much more what a state with responsible access should look like, while eliminating diversion, limiting sales to folks who are 21 years of age or under, but at the same time creating a structure for businesses where they can actually make money. And that's a huge missing piece, I think, with the current structure. Right now you have, I think, 4 cultivator licenses, limited to about 1,200 plants, which might sound like a lot, but in order to supply an entire state, you're going to need probably several facilities around 60,000 to 90,000 square foot, where they're growing tens of thousands of plants. So, right there, when you're looking at it from an unbiased perspective, it's clear that it's been set up to really fail from the beginning. And Senator Holcroft, you brought up voters' intent, what voters voted for. And I think if you went out today and asked anyone who voted in favor of the ballot initiatives last year, they wanted a functional working system. Whether or not that includes flower that you can smoke, you can at least admit that the current structure right now, it's going to be inaccessible to most people and as well as impracticable to work from a business perspective.
Senator Shore?
I just meant, are the tribe in the state following your lead on this?
Excuse me, sir?
Are there other tribes and sovereignty in the state following your lead on this?
I haven't had any conversations with other tribal leadership. I suspect once they see our success, they might try and jump in as well. But as of right now, it's just the Omaha Nation who's going down this path. Thank you.
Senator Thorne?
Thank you for being here. So I have one question. Are you talking about recreational marijuana?
No, sir. So
Mouse you just talked about were huge excessive, so I'm just confused on that.
yes, and let me clarify, Senator. So our Title 51 code, it authorizes our Cannabis Commission to license both medical and recreational establishments, but right now we're focusing on strictly medical cannabis because, in my opinion, since it's legal in the state of Nebraska, for us to be good neighbors, we want to work with the state and our neighbors with a medical program first and foremost. But, there's a big difference between what our Omaha Cannabis Commission and Nebraska Medical Cannabis Commission has promulgated for rules.
So you're looking at recreational too?
Not at this time. We're focusing right now on the rollout of our medical program.
Go ahead.
Senator Roundtree? Thanks so much, Mr. Chair. Thanks so much for your testimony and giving us a historical perspective as well. What type of feedback have you gotten from the public as far as shooting going forward? Has there been particularly negative pushback or encouraging moving forward?
Thank you for that question, Senator. So our first Cannabis Commission meeting was on Monday, and we invited members of the public to join, and we had both tribal members and non-tribal members attend, and it was truly historic. The support we've gotten from everyone has been resoundingly positive. The only pushback that I've experienced or heard so far has been coming from state officials who I think are frustrated that their attempts to do a backdoor ban of the industry are failing on the reservation grounds. But certainly the patients who've been frustrated, the parents who've been devastated by the current rollout on the Nebraska territory, I think have been looking to us for that relief. And so we've received just hundreds of people who've come forward and thanked us and are really gracious about the courageous step that we're taking because, as I've mentioned, we're already being retaliated against, and that wasn't a surprise to us, but this is the right decision, and it's not just for tribal members, it's for all Nebraska.
All right, thank you so much, and I appreciate your sovereignty, and I appreciate your willingness to be collaborative.
Thank you, sir.
Senator Quick? Thank you, Chairman. You talked about a compact. Is that a compact between the sovereign nation and the state, or is that a compact across all the states?
Great question, Senator. So when you look at tribes and how they interact with states, oftentimes we enter in what's called compacts with the states. So under Nebraska law, there's a specific statute that authorizes the governor to enter in tobacco tax compacts with the various tribes. Right now, the Santee tribe in Nebraska has a compact where 75% of the taxes collected on the reservation goes to the tribe, 25% goes to the Nebraska Tax Commission. In July, we submitted our intent to the governor to start this process under the statute. And in August, we sat down with Attorney General Hilgers and his team, who is designated to lead the negotiations. And we submitted our draft compact at that time. And we were promised certain revisions, certain follow-up for weeks, months, until an hour before our commission hearing where they just flat out said they're not going to do it because we're doing medical cannabis. So, I don't want to hijack the topic of this commission, but I think it's important for the public and senators to understand that, we're trying to be squeezed, and it's not okay. But hopefully that can be fixed moving forward, and we remain hopeful. And in the future, we'd love to enter in a cannabis compact with the state of Nebraska too, which is also done when you look at states like Minnesota, Oregon, and other places where there's cannabis programs, and then there's tribes who enter into the industry and want to work in lock-step with the state, which I think then everybody profits from that structure.
Thank you.
Thank you.
Any other questions?
We'll go with Senator Gabbard.
Okay. Thanks for being here, Mr. Cartier. So, in terms of the system for the tribe, where will the dispensaries be?
First of all, thanks for inviting me today, Senator Kavanaugh, and for your courage bringing this issue forward. So for us, the dispensaries will be somewhere on the reservation. We haven't locked down the specific real estate piece, but obviously we would like to be closer to the Omaha metro area where we can service the most patients, and it's easy for them to get to the reservation and purchase product. But in the future, we could have several locations all across our reservation, which if you look at the map, it's about an hour north of Omaha, and then right above us is the Winnebago Reservation. And it's a beautiful place if you haven't visited. We open invitation from our tribal council to any member of, especially the Nebraska Senate, who wants to come and visit us. And once we get our cultivation going, our dispensaries going, again, we'd love to do tours and show folks how a responsible, well-regulated industry can proceed.
And for somebody who, say, has a doctor's recommendation in Omaha, the idea would be to drive up to the reservation and buy their up to 5 ounces?
Yes, sir. We haven't worked out the specific daily maximums, but it makes the most sense to match that with what's lawful for patients to currently possess. So everyone's clear, once we're open, we will allow both tribal members and non-tribal members to come to the reservation and to make those purchases if they have the recommendation from their physician. But the caveat there is, and I want to be honest to everybody, I've been told already that a huge reason why they don't want to move forward with the tobacco tax compact is because the state anticipates expending more law enforcement resources trying to police our border and try to frustrate non-tribal members who come to the reservation and make those purchases, which I think is unlawful, doesn't match what's in the Nebraska statute, but that's going to be a future fight we'll unfortunately have to probably go down.
So just so I understand, someone is saying that they're going to detain people when they come off the reservation and to search them, I guess, to see if they possess lawfully purchased.
That has been the implication, Senator. Yes, absolutely. And, we could debate whether or not that's proper. I think, though, how the ballot initiative was structured in the current law and the statute, it's clear as long as you have a recommendation from a physician, can be out of state, can be in the states, you can currently possess up to 5 ounces of cannabis and cannabis products, Senator Holcroft. I think going back to your conversation with Senator Kavanaugh, and these are important details to work out, so I really applaud you for getting down into the details. It's the whole encompassing plant, and it's further defined as well as the various cannabis products that come from the plant. And again, when you look at what the voters wanted, what the drafters' intent was, there's a lot of people who purchase bulk flower and make their own products. You wouldn't be able to do that under the current Nebraska Medical Cannabis Commission rules and structure, which was something that I know that the folks who put forward the ballot initiative have fought for over a decade to have that right. Thank you.
Senator Harrison.
Thank you, Chairman and Attorney General Cartier. Thank you for being here. I am not a lawyer, and I am not that familiar, so I have questions about tribal law. So the jurisdiction of this is it covers Native Americans and only on tribal land. Is that accurate?
Yes, sir.
Okay. So then, your definition and how you define the provisions of medical cannabis only apply to those people on the tribal land. So then how do you have somebody like, say, Senator Holcroft decides he wants to go up there and he meets with one of your doctors who says, oh yes, you should have a card. Does that mean he's not authorized to buy medical marijuana and however you prescribe it, even if it's in direct conflict with the state? Is that true?
So in our opinion, it isn't in conflict with the state law. It's only in conflict with the regulations proposed by the Nebraska Medical Cannabis Commission. And when you look at the hierarchy, this is a good opportunity to kind of explain this. The hierarchy of legal authority and what can defeat another. The Constitution, the federal Constitution sits up here, right? Next goes state constitution. Then you get into state statutes. And then way down here is administrative action. Administrative action includes regulatory rules that's promulgated by commissions, by various departments and agencies. Those can't rewrite and fundamentally change what's above them. So it can't rewrite what's in the Constitution. It can't rewrite what's in voter-approved statutes. So for us, you come on the reservation, you have that recommendation. Under Nebraska law, you can possess today up to 5 ounces of cannabis products. So yes, you'd be able to purchase cannabis products and possess that and still be lawful on the reservation and off the reservation.
Is that what the Nebraska Attorney General would say?
No. I don't think he has he's worked out his legal opinion quite yet, but he has a team that is working day and night for it.
Okay, just for scope, for my knowledge, what is the population of the reservation?
Thank you, sir, for asking that question. So the Omaha people, we have a total enrolled tribal membership of about 7,200 people. On the reservation itself, there's about 3,000 to 4,000 individuals. You could say our capital is Macy, Nebraska. It's a small town, about 500 to 600 people live there, and that's where we work out of. And then outside the reservation, you have a couple thousand people that live all the way in Europe, but they're all over the country and all over the world. And we also anticipate to pass during our elections next week something that's going to change our qualifications for enrollment. And we anticipate probably having closer to 10,000 enrolled once that happens.
Okay, and how big is the reservation?
I don't remember how many square miles it is, but if you look on Google Maps, for example, it'll show the outline of what it looks like, and it encompasses Pender, Macy, Walt Hill, and then again right above us is the Winnebago Reservation.
Kind of piggybacking on with the question from Senator Storm, when you guys implemented your tribal law, is that what you call it?
Yes, sir.
When you implemented the tribal law and you passed it, it does have a provision for recreational marijuana as long as over the age of 21.
Yes, sir. So I drafted this, and instead of revisiting this topic in the future, I decided to put in the framework for an adult use structure. But again, we're focusing squarely on medical cannabis at this time. It would probably be appropriate once the state decides to move towards adult use legalization, if that ever happens. But irregardless, right now we have it working to issue a vertical license, which we've already done to the tribe, and that vertical license will support a medical cannabis industry. And maybe the future has something different for Nebraska, but if you ask me honestly, I don't think you guys are going to move forward on that anytime soon, and that's totally okay. That's your right. When you look at other native tribes in different states who have gone down this road, they match closely with the regulatory structure of the state, and that's, I think, an important thing of being a good neighbor and being responsible legislating. So at this time, we don't have any plans to move forward with recreational cannabis. But as you stated, that framework is in our Title 51 code.
So just out of curiosity, what would it take for you guys to implement recreational marijuana?
The political reality is it's probably going to take a ballot initiative from the people, again, to implement recreational adult use cannabis in the...
Native American, not the population of the state.
No, the population of the state, yeah. So once the population of the state or the unicameral passes adult use cannabis structure, then it would be appropriate for us to move forward with an adult use cannabis structure.
Okay, so I wasn't clear on the question. The proviso is there in the tribal law for medical marijuana as well as recreational marijuana.
Yes, sir.
At this point, you said the focus of the tribal leadership is medical marijuana, and they're not really looking so much at recreational. Should that focus change? Because you made a comment, you said something about part of it's just really about money. I think that was your comment. So when it gets back to short times and money, then the federal side, the federal issue says, well, we have a revenue stream right here that we're just waiting to turn on, being recreational marijuana. So what's the mechanism? Would it take it that enough for them to say, hey, it's in federal law, we can turn it on, we just have to, what is that?
So our government is a 7-member tribal council, and next week we're going to elect, it's a staggered term, so we have 3 members up for election next week, and any sort of regulatory change, any sort of code passed or direction for the sovereignty and welfare of the tribe has to go through the tribal council. So it would take a majority vote of the tribal council to say, look, now we want to move forward with an adult use cannabis industry on our reservation.
So simply a vote of the council, majority wins, straight up majority, right?
Yeah.
Okay, so 3 new people coming out, they can all be big fans of recreational marijuana, and then you have a majority, and they say, hey, we're going to do it now.
Potentially, but they ask my counsel on these types of matters, and again, for the new incoming members, I would encourage them just to focus on the medical cannabis side for now. All the patients and the parents who've come forward and have been pleading for access up to this point, they're really looking for us for that leadership and that ability for them to move forward to get those products. So, I don't think it would be a good time to radically change, our direction right now. But it's an option moving forward in the future if they so decide.
Yeah, I know from my experience in the military, you can make recommendations to leadership, but leaders are going to do what leaders are going to do. My last question is, you mentioned you had the first meeting of the York Cannabis Commission. Are you publishing meeting notes?
Yes, we'll have meeting notes pursuant to our Chapter 51 title, as well as our rules and regulations that we're promulgating. We had to appoint officers, so now we have a secretary, we have a chair. Don't have a vice chair yet, but that secretary position, taking the meeting minutes and that type of stuff. So all that will be public, and our open meetings will be the 3rd Wednesday of every month. So I anticipate next meeting this coming month in November, we'll have hashed out the final edits to our rules and regulations, and then once that's done, we'll publish that and continue to move forward with our enterprise.
Excellent. And thanks again for being here and being patient and answering my questions.
Any other Klaus? Thanks, Sarah. One quick question. So your rules, you allow smoking?
Yes, sir.
Thank you. Any other questions? Oh, yeah.
Thanks again for being here, and I just want to follow up a little bit. So the tribe's authority to legalize recreational and medical did not just come about as a result of the state ballot initiative. Is that right?
Correct.
And so for however many years before 2024, the tribe could have legalized recreational or medicinal if they chose.
Yes, when you look at what other tribes in various other states have done, some have taken a very aggressive approach. The Flanju Santee tribe up north in South Dakota, they legalized medical cannabis in 2015, despite South Dakota obviously being a prohibition state up until recently. So they could have gotten a lot more aggressive, but I think it was a combination of factors that led us to where we are today. But a huge reason is the passage of the ballot initiatives last year and signaling that this is the time for us to move forward, especially when seeing the dysfunction at the Nebraska Medical Cannabis Commission level.
So just to be clear, the tribe chose to move forward. They could have moved forward before, but basically in partnership with the voters in the state of Nebraska moving forward this time.
Yes, sir.
Well, thanks again for being here.
Thank you.
Any other questions? Senator Kay.
Thank you for being here. Are there any other Native American tribes, say, in the states of Colorado, Missouri, that are compacts with dispensaries and stuff for medical marijuana?
I'm not aware of Colorado and Missouri. There might be. The ones I've looked at most recently have been Nevada, have been Minnesota, have been Michigan, have been Oregon, some other states where there's a lot bigger tribal presence. If I did some digging, there probably is one. But it's a really important tool for both governments to come to agreements and figure out situations that work in benefits of both parties. For the tobacco tax compact specifically, we don't want to double tax cigarette products, but we could do so if we really wanted to. It's a lot cleaner just to move forward with a single tax and to figure out a fair split of that revenue. And it's been something that's been collected on the reservation for decades without any share going to the native tribes. And we're not asking for any of that. We're asking for a clean deal moving forward, which, at least matches what the Santee tribe is receiving.
You're working with your commission or with the council stuff to concentrate on medical marijuana, medical cannabis. Why don't we put recreational part of that aspect on the back burner and not even have a part of this conversation and just concentrate on medical right now rather than having that in the background, recreational use in the background? Why don't we just concentrate on the medical right now?
To be fair, Senator, I didn't bring up recreational cannabis today. We are moving forward just with a medical cannabis structure. That's what has been discussed on the Omaha reservation up to this point. It's our decision, and it's our right to draft our codes the way we want. So at the time, it made sense for us to leave that structure in place for the day when it does move forward, if it ever happens. But again, we're just doing medical cannabis, and I don't see that changing anytime soon, unless there's a huge shakeup at the state level, which will probably just happen through a ballot initiative at some point. To Senator Kavanaugh's point, I think if the Nebraska Medical Cannabis Commission continues the way it does, you're going to see a lot more angry voters, a lot more angry people that led to this ballot initiative, and to start with, this series of ballot initiatives over the last decade. So, not to be rude or anything, Senator, but we would love to focus just on medical cannabis. I think that's the priority. That's what people have been asking for in this state, and that's what's going to bring the most relief to thousands of Nebraskans.
Thank you.
Senator Hanson?
Thank you, Chairman. Sir, follow-up question. In your federal law that authorizes medical marijuana, is there the proviso that has to be prescribed by a physician? And what's the definition of that? Is that an MD? Is that a healthcare worker? What are the boundaries of that?
So right now, our structure for who can recommend cannabis to an individual matches the states. So physician assistants, nurse practitioners, MDs, those that are qualified to issue. It's also different because it's not a technical prescription, which a lot of people use that as a misnomer. It's a recommendation, which is very similar, but is different because technically, still a Schedule I drug. You can't issue a prescription for one of those at this time.
Okay. So then if you had a Native American doctor who prescribes marijuana for somebody, do they only prescribe for Native Americans, or can anybody go there and go meet with them and get a prescription?
Anybody can go up and get that prescription or recommendation. And we're also going to use reciprocity, so anywhere else in the country where they have received that recommendation from a healthcare provider, we're going to accept that as well.
Okay, so if you're in a state that has outlawed, it doesn't have the provision, theoretically somebody can drive over to the reservation, meet with your doctor, get a prescription, get cannabis, and leave.
Yes, but if they're trying to return to their state and it's an illegal state, still crossing borders is an issue. But as long as they're on the reservation and in Nebraska, it's legal.
Okay, just out of curiosity, do your medical practitioners, are they registered with the Department of Health and Human Services in Nebraska?
So we have a Carl T. Curtis Health Center, and that is basically like our regional hospital. Up north is 12 Clans Health Clinic as well, ran by Winnebago Tribe. And we have regular doctors, MDs, folks that are, I believe, registered through the appropriate channel so that they can issue care to both tribal members and non-tribal members.
So in statute it says that person prescribing this Mexican controlled substance in Nebraska must be registered with the Department of Health and Human Services. So they are not registered with the Nebraska Department of Health and Human Services. Different jurisdiction, is that my understanding?
I'd have to double check. My understanding is that they are, but again, I'd have to follow up with you on that, Senator.
Okay, because if they're not, then it seems like then they could prescribe for somebody that's not Native American because it's outside the jurisdiction.
And then if that's the case, then what we would suggest is you can get a recommendation from a lot of different other providers that do telemed, for example. So if that was a hang-up, then potentially. But either way, I think the statute is very plainly written that any healthcare provider inside or outside the state is able to issue that recommendation. And the debate over whether that falls under the relevant Nebraska statute, I don't know if that's is important as much so as what the plain language is of the ballot initiative language and what the intention will of the voters was.
No, I understand that. My concern is for the safety and security of the people of Nebraska, right? To make sure they don't get in a situation where they are now subjecting themselves to being arrested and potentially going to prison because they did something they thought was okay, but was not. That's why I asked the question.
Right. And yeah, I'd love to follow up with you on that question, Senator. I think that's an important one.
Thank you.
Any other questions? Thank you, gentlemen, for the
Thank you, Senator.